So we've all seen the studies looking at the mixed dopamine serotonin receptor antagonists in patients with OCD. Why would we use an antipsychotic in patients with OCD? Well, for many of the same reasons that we would use an antipsychotic in patients with treatment-resistant depression. Remember, most of our atypicals are going to be 5-HT2A antagonists. And so if we think about where 5-HT2A is primarily distributed, it's presynaptically in terms of an autoreceptor effect. So what happens is in antagonizing that, it's one more mechanism by which we can increase serotonergic tone in our patients. So complementary to the effects of the SSRI. Now, the other thing, when we look comparatively at the second-generation antipsychotics or the atypicals in patients with OCD, we tend to see that those that have a little bit more D2 potency tend to produce some greater improvement, depending on the metric that we're looking at. Now, I want to call your attention to one study that's generally brought out or touted as evidence against SGA or atypical augmentation in patients with OCD. And this is a study by Blair Simpson that was published a number of years ago. And what's interesting is that there were a number of factors that probably contributed to this lack of effect here. So first of all, most of these patients were SSRI responsive. We know from other studies that it's more likely to be the patients who are SSRI non-responsive who are likely to benefit from an atypical in OCD. But the other thing is that these are patients where we're looking at an adjunctive intervention, which makes it really difficult to detect an effect in these clinical trials, especially when we're comparing this to other interventions that we know work. So what she found in the study was exposure response prevention really beat out the SGA. What's also important to remember about the study is that this is heroic psychotherapy. This is 2 90-minute sessions each week for 8 weeks. Very different than certainly what my patients get when they get psychotherapy for OCD. Now again, this slide really just emphasizes the fact that the second-generation antipsychotics do have benefit in patients with OCD.